Good morning, everyone. So today I'm going to talk about going beyond the chief complaint and finding ways to connect with our patients outside of their room number and their chief complaint. But for me to do this today, it's a little uncomfortable. It's talking about something I was raised you really shouldn't talk about in public, with those three things being politics, money, and religion. So I know there's a lot of political conversation going on right now, and I think it's about time that I'm hearing a little bit more about this in my friend group and at work. But today I'm going to actually talk about my faith as a provider and as a physician. So growing up, I was baptized in the Greek Orthodox Church. My dad was Orthodox, my mom was Roman Catholic, and they decided I would be brought up in the Orthodox Church, going to church every Sunday, Sunday school. It was very strict. I had to wear kind of all black to most of the services, couldn't sit a certain way, had to cross my legs a certain way, and wasn't allowed to go up to the altar that was reserved for just men. The services were pretty much all in Greek, and while I speak and understand Greek, it's a lot of like chanting, humming, you just kind of can't really understand anything. So I would sit there most Sundays not really knowing what was going on, but still felt a connection to the Greek community, the Orthodox community, and just my faith with God. But a couple things happened in my childhood that didn't really completely break me away from my faith and my love for God up until my dad died. When I was 16, my dad died of an aortic dissection. And that was it. Everything I had seen before then, I thought, I could get past this. I still think there's good in the world. But after that, I thought, there's no way there can be a God with all these bad things going on, with all this suffering. And so instead of putting my faith in God, I thought science was a little bit more reliable. Science was something I could see. I didn't have to have faith in it. I could see the goodness that was coming. And so I went into, obviously, medicine, and I put all of my trust into that. Somehow, I matched at Loma Linda, and mind you, for the 10 years before Loma Linda, I didn't pray, I didn't go to church, I didn't think about God at all. And at Loma Linda, there's definitely a religious undertone to the institution, but I think our program has done a good job with not making us feel that pressure in the actual program, which I respect, and I'm really happy that we don't do that. And so I kind of just went on my way for the first couple months of residency. And most of you guys know my story with the Appy gone wrong as intern year. There's a little bit of the story that you guys don't know, but when I was admitted, I was in the hospital for about 6 days, and I was getting really frustrated because I felt like I was losing my independence, my freedom. I got pretty deconditioned in that hospital bed, even though it was only a handful of days. I needed help kind of getting out of bed and walking to the bathroom and just doing things that I kind of took for granted. So one night I had gotten fed up because it was the third time my IV blew and I needed some more pain medication. And so I called in the nurse, and she was this cute, I think probably recent grad, who came in, and she could just tell I was really frustrated. She knew something was going on. And so she called in the VAT team. While we were waiting for them, I guess I'm a hard stick apparently, but she asked me a question that caught me off guard. She asked if she could pray for me. And that was kind of the first time something like that had happened in several years. And she reached over the bed and she grabbed my hand, and a complete stranger for several minutes just said a prayer for me to get better, for me to find my health. And I started tearing up because I felt this strength come up inside of me that I knew wasn't coming from myself, it was coming somewhere else. I thought, this is great. The next day I got discharged and left without having to sign out AMA, but I didn't really think that much more of it. I was like, okay, this is a one-time thing. I was in need. It made me feel better. Great, going on with my life. A few months after, I was in the ICU, rounding with the ICU team, and I was with Dr. Tan this week. We had been rounding on a 30-year-old patient who had pulmonary hypertension. She was on a Remodulin drip and had pretty much, since her diagnosis, been in and out of the hospital. She had a couple kids at home and a young husband that she was missing out a lot about what was going on at home because she kept coming into the hospital. And we saw the same frustration in her eyes that I had a couple months before. Obviously, hers was a little bit more severe and significant. You could really tell she was troubled. And Dr. Tan, in the middle of rounds, stopped and asked her if she was religious and if he could pray with her. She said yes, and the entire ICU team joined hands and we prayed for her. And after that, when I rounded on her the next few days, I just felt this connection with her that made me want to be a better doctor. I would spend a little bit more time in the room. I would double check the orders, just making sure that she was getting the best care that she could get. But I thought, I don't really have time for this in the ED. This is just an ICU thing. They have weeks, sometimes even months, getting to know these patients, these families. I can't do this in a couple of minutes. So I just thought, okay, great. That's something they do upstairs. Can't do it in the ED. A couple months into third year, I recognized a patient's name on the track board who had already been admitted, and so I really shouldn't have even paid attention to her name because once they're admitted, I don't really care. But her name stuck out to me, and it was a patient that I had on CCU as an intern. I rounded on her for a couple of weeks and looked at her LVAD settings and eventually became kind of friendly with her. She had a young, I think he was like 3 or 4-year-old boy at home, and one day she was trying to find out if she could go visit him downstairs in the lobby. She wasn't able to have him come upstairs because I think it was around flu season and obviously he wasn't 18. So somehow I got the nurses to agree with me to let her go say hi to him. And so we just made this bond together that was really impactful. She was probably one of the more impactful patients I've had all of residency. And when I saw her name in the ED a few months ago, I had this like desire to just go talk to her. I'm like, she's probably not going to remember me. She's been in the hospital, I'm sure, numerous times. She sees a bunch of faces. There's no way she's going to remember me. But I went in the room and I started to talk to her. And she recognized me, and I could tell she was getting a little emotional. And this was the first time that I actually on my own prayed with the patient. I grabbed her hand, I asked if she would be willing, and she said yes. And we said a short prayer in the ED. And I felt really empowered after that, and I could tell that she did. I found out a couple of weeks after that she was rejecting her second heart transplant. So she has an incredible uphill battle that I hope the few seconds that I spent with her shows her that she'll be here a lot, but that people here care about her. So I think sometimes we forget that when sick people are coming, they're experiencing a time where their strength is failing. They see their lives kind of slipping from their hands. And when we're healthy, we tend to forget all the blessings we have. We oftentimes kind of reconnect to God or find our faith in God when our sickness is failing. And so a lot of our patients may be feeling this way. And so we as physicians are really privileged and have the powerful opportunity to make a difference for them, both medically and spiritually, and just with compassion. A lot of times our human efforts will fail, but we still need to realize that we can kind of help heal people's souls, not just the physical, but something a little bit more deeper. So I challenge you guys all to think of having room for both people's emotional, spiritual needs and their health needs. If this is something that you guys are willing to do, I think there's a couple ground rules that you should think of. Feel how comfortable you feel praying with your patients, feeling what the situation is like, and seeing if they're receptive, making sure you ask if you are going to go down this pathway. If you're not comfortable, there's chaplains, there's social workers who can kind of help you with this stuff. But I still think it's a part of our job to think about those things. And I know sometimes it's challenging in the ED because we're so busy. But with really sick patients, or when something really bad happens, I think we should try to have these conversations with patients. If they are willing, I think it's important to know their name, to have anyone who doesn't feel comfortable step outside the room, say a short little prayer, keep it from your heart, try and wrap it all up, and then see how it makes you feel, see how it makes the patient feel. There are other ways of connecting with your patients if you don't feel comfortable doing these things. I think I've tried to incorporate into my practice just knowing my patients' names instead of being the chest painter in bed 5. And I tried to at least ask when I go into a room who the other people are with them. It just builds a sense of community that I know who's with the patient, and if I'm asking questions, I'm asking them knowing their names. And you can pick up on cues. Some people may have rosary beads or the Bible, but other cues are important for not only, our job as doctors, but just having conversations with these people. A lot of times I'll ask what they do for work or their hobbies, and if you have a little kid who's wearing like their soccer shin guards, you can ask them like what position they play, just to kind of bridge the gap between, doctor and patient and more, we're both humans together. How can I help make you feel better? I think we often skip listening with respect. We listen, but I don't know if we necessarily hear. A lot of times when I'm talking to a patient, I find myself thinking of the next question I want to ask, thinking of the next task I have to do, instead of really focusing on what they're saying. And sometimes we're quick to cut patients off within 10 seconds of them talking. That's too much. 10 seconds is too much. Got to ask my next question. So try to be a little bit more patient and give them some time to talk because they want to be heard. Being empathetic is a huge one. Sometimes people think you're either good at it or you're not. I think it's more of a skill that you can build on. So challenge yourself with finding ways to be a little bit more empathetic and apologize as needed if things have not gone the patient's way, if it's been a long time for them to see you. Just recognize and acknowledge and apologize for that. I think the big take-home point is these people who are coming in are having these big life changes, who are either themselves suffering from a stroke or having a family member that's suffering from something, and their lives are going to change. And we need to remember first and foremost to be a kind person instead of just a really good doctor. And if we can incorporate being a really good doctor that knows how to manage their care on top of being something that really understands where they're coming from, I think it'll make a big difference in the way that you experience your shifts, because the most I think heartfelt patient experiences will come from the ones where you open your heart up to them more. They'll be the ones that you guys remember. So again, this was just kind of my story over the last few years and my journey, and I know it's not for everyone, and that's totally fine, but that's kind of what I wanted to talk about today. Thanks.